Good afternoon, everybody. My name's Debbie White. I'm the president of Health Professionals and Allied Employees, and I'm also an RN. We are a union of nurses and other healthcare workers, and we represent 14,000 members. I'm joined here today with the presidents of 3 of our locals that are currently in bargaining. Their contracts expiring on Friday. They are bargaining with 3 very wealthy hospital systems at Cooper University Healthcare, Englewood Hospital and Medical Center, and Hackensack Meridian at Palisades Medical Center. Each of the local presidents are bargaining with a primary goal in mind, and that is to address retention of nurses and other frontline staff in our hospitals and to improve the standard of patient care by incorporating safe staffing language into contracts. This is the goal of our union. This is a non-starter for us. Members are willing to do whatever it takes to get this language. We need it in our contracts. And this is including giving a 10-day notice for strike if necessary. Look, we have a problem of retention of nurses and other frontline staff in our hospitals, especially those directly caring for our patients. Nurses, not only in our state, but across the country, have been clear about the solution to this problem: nurse to patient ratios. What does that mean? It means setting limits on how many patients any one caregiver, whether it's nurse or nursing assistant, can be assigned at any given time. We will not be able to settle any of these contracts without safe staffing language. Our healthcare workers will not stand for the status quo. And unless we address the issue of safe staffing, nurses will continue to be a line item in a budget, cut to its lowest number to maximize profits. And our frontline staff will continue to migrate out of our hospitals due to stress and burnout. By the way, this issue is so important to us. We also have a bill entitled the Patient Protection and Safe Staffing Act. Bill numbers are S2700 and A3683. This bill addresses staff to patient ratios because not every hospital is organized. Not every hospital is held to a contract, and not every healthcare worker is a union member. Unions are leading the way for safe staffing. Ratios are not new. California has had a law mandating nurse to patient ratios for 20 years. And multiple studies now show that it's the right thing to do, not only to retain nursing staff, but for patients and, frankly, for the hospitals themselves. When nurses have lower patient assignments, patients are less likely to die, are less likely to develop complications, less likely to get hurt, less likely to be readmitted, and have higher patient satisfaction scores. And that makes sense. If your nurse is not overwhelmed and stressed out and burned out, they're going to be present for patients. And because of the better patient outcomes and higher patient satisfaction scores, where ratios do exist, hospitals are reimbursed at higher rates. And ratios will solve the retention issue in hospitals. Nurses will stay, and for hospitals, the turnover costs will decrease. So safe staffing not only saves lives, but it saves money. I want you to hear from the 3 leaders of the locals that are in bargaining. So with that, let me introduce them to you. I'm not sure if Doris is on. She had asked to go first. But if she's not here right now, because I can't see her name, let me start with Tara Rojo, president of Local 5030 at Hackensack Meridian Palisades Medical Center. Tara.
Thank you, Debbie. Good afternoon, everyone. My name is Tara Rojo, and I have been a nurse also for a long time now. I am president of HPAE Local 5030 at Palisades Medical Center, where I work in the medical surgical unit for more than a decade now. We are currently in negotiation, and in fact, we are on our last 3 days in negotiations with Hackensack Meridian Health, the corporation that owns our hospital. And from day one, we have been demanding to have in our new contract strong, enforceable, safe staffing ratios so we can keep patients safe. Unfortunately, HMH refuses to even consider safe staff to patient ratios as an option to improve patient care. In a perfect world, the HMH would be fighting for the same thing we want. Safe staffing ratios would allow me and my colleagues to provide care that will help our patients have a better outcome. But no longer will we accept our employers' resistance. We are fighting for our staffing ratios in our contract and a New Jersey law to ensure every patient in every hospital in our state has enforceable safe staffing ratios. The law is the Patient Protection Safe Staffing Act. Achieving such common sense protections for us and our patients has proved to be a challenge. Definitely a challenge, but it is a challenge that we are ready to face in Trenton and at bargaining tables with employers. Listen, we should not, and we are not flying blind here. Lots of research shows safe staffing ratios work, that they save lives. California's mandated safe staffing ratios went into effect way back in 2004. And these studies researching California's mandated nurse-to-patient safe staffing ratios show California patients are more than twice as likely to report high satisfaction with their care, and their nurses reported significantly lower burnout. This created more reasonable workloads for nurses in California hospitals, leading to fewer patient deaths and higher levels of job satisfaction than in other states without mandated staffing ratios. And the truth of the matter is everyone, and no exemption, will eventually find themselves in need of hospital care. And every patient deserves a higher standard of care. HPAE has released a code red position paper, which highlights the facts on safe staffing that are backed by dozens of current and older studies. That paper also contains the stories and experiences of nurses and healthcare workers who have witnessed the hazards associated with short staffing. My sincerest hope in talking to you this afternoon is to urge the public, everyone, including our patients, our communities, to help us in this fight, to help us achieve safe staffing ratios in our union contract and the law of the land in New Jersey. Thank you.
Thank you, Tara. Appreciate that. I'm going to go to Doris Bell. Doris is actually working today and taking some time out to be on this call with us. So Doris Bell is the president of Local 5118 at Cooper University Medical Center. Doris, take it away. And you're on mute.
Okay. Hi, my name's Doris Bell, and I'm a registered nurse and president of HPAE Local 5118 at Cooper University Healthcare. We work under tremendous pressure daily because of understaffing in our hospital and in our outpatient facilities. Our local of 1,500 registered nurses are dedicated to caring for our patients. We need to be able to care for our patients to help them recover and return them to their loved ones. That is what motivates us every day when we come to work. As you know, we are renegotiating our current contract, which is set to expire on May 31st. Our primary goal in negotiations is to improve our nurse-to-patient ratios where they currently exist in our contract, and to implement ratios on additional units throughout the hospital. Let me state clearly, our nurses are united in this fight to hold Cooper accountable. We are determined to improve patient care by setting safe staffing ratios across our hospital, ones that can be enforced through our contract. As nurses, we know how important it is to have enough nurses on a unit to provide the highest quality of care to our patients. And we know the right number of patients we should be responsible for doing our shifts. Staffing based on these ratios gives us time to provide the care that we are trained to provide, including being able to sit with a patient, alleviate some of their fears, and provide them and their family members with information on how to continue their care after they leave the hospital. All these functions are critical to providing proper patient care. Nurse-patient conversations can ease their anxiety and help them to understand the information they need to know so they can get better. Having that information would hopefully lessen some of the anger and aggression towards us. For the sake of our patients and nurses, Cooper needs to do what it takes to improve patient outcomes and retain our nursing staff. Safe nurse to patient ratios is the solution. Our nurses deserve safe staffing. Our patients deserve safe staffing. Safe staffing saves lives. Thank you.
Thank you so much, Doris. Thank you for taking the time out to come with us today.
No problem.
And finally, in our lineup, we have Alice Barden, who is the president of Local 5004. They also call it 5004 at Englewood Hospital and Health System. Our first ever unionized local. Alice.
Good afternoon, all. As Debbie said, my name is Alice Barden, and I am the president of HPAE Local 5004, representing the nurses at Englewood Hospital. Just to give you a little background, our local was the founding local of HPAE, as Debbie mentioned. In becoming the founding local, we transformed how healthcare was delivered in the state of New Jersey. We've changed the lives of thousands of residents of this community, this region, and our state. After graduating from Rutgers School of Nursing, I came straight to Englewood, and I have worked at Englewood Hospital my entire nursing career. For the last 22 years of that career, I have worked in maternal child health. None of the progress that we have made in providing healthcare has come easy. And as we negotiate a new contract with Englewood Hospital, we are confronting similar challenges to what you've heard Tara and Doris speak about. Simply put, there is a chronic staffing crisis in hospitals across the state, and we're experiencing the same crisis with retention here at Englewood Hospital. As we're in negotiations, we are demanding that the contract we're negotiating has stronger, enforceable, and that's my key word, enforceable safe staffing ratios, so that we as nurses and healthcare workers can keep patients safe and provide the best care that we're trained to give. And that is the goal of every nurse. This will help us to recruit new nurses as well as retain nurses that we have already gotten, so that we can grow the profession to train the next generation of nurses while also providing care to families in our communities. And you would think that this is common sense, it shouldn't be a hard sell, but unfortunately it is. Research shows that mandated nurse-to-patient safe staffing ratios lead to high patient satisfaction in hospitals, and that nurses are safer, and that they also suffer less burnout. HPAE Local 5004 nurses are also members of our community who actively receive healthcare at the hospital in which we work. We not only work here, taking care of our families and neighbors, but it is the place where we often receive our healthcare too. So being on the inside of this and also on the outside of it, knowing that at some point we and our loved ones will require the care of our institution, it is very important to us that we have safe staffing ratios, that we have nurses that aren't burnt out, that are able to give care compassionately and safely based on their licensing. So we just hope that you will join us in sending a message to hospitals and legislators and even to the public that safe staffing truly saves lives, and New Jersey needs safe staffing in our union contracts, and more importantly, as a New Jersey law. Thank you.
Thank you, Alice. Thank you, Tara. Thank you, Doris. In the chat, you will see many links to different research and the white papers that we've done. We also have some a survey that we had conducted across the state. All nurses responded to that survey, and we are speaking here on behalf of what they said to us in that survey. Nobody wants to go on strike. No nurse wants to stand out on a picket line and be on strike. But our members are no different than those steelworker nurses that you saw last year who were willing to spend 5 months out on a picket line until they acquired safe staffing language in their contracts. It is that important to us. So thank you all for coming. We will keep you all posted. I'm not sure if we have any questions at this point.
Hi, Josh Backen from patch.com. I just wanted to gauge a timeline. Are each of the contracts expiring May 31st?
Yes.
And from that point, there would be how long of a notice before?
We're required by law to give a 10-day notice to the employer so they can find replacement staff.
Got it. And I'm not sure if you have this data available, but do you know the current staffing ratios at each hospital and how that compares to the ratio that HPAE would like to see?
Well, I don't have every contract. We have all the HPAE contracts in on our website. So the staffing ratios vary, which is why we currently need a law, because not, like I said earlier, not every hospital has a union. So we need this in law as well.
Thank you.
Scott, did you have a question?
Yeah, first off, just some nuts and bolts. How many members are at each hospital?
Palisades Medical Center probably has 750. Englewood has about 800, and Cooper has about 1,500.
Do you have the breakdown and percentage of members who voted to authorize a strike?
Let's just say the authorization was in the 90 percentile.
At each unit?
Yes.
So one thing that the hospital associations say is that if this law is passed, and they've been saying it for years, that management would not have the flexibility they need to potentially move nurses around to care for patients, since that could change quite a bit at a hospital. What do you say to that argument that they say often?
So
So
that's a
I
really
would-
old argument. And I would say flexibility to do what? To move their profits around, maybe? Honestly, the most important thing to patients is ratios. They want to have an available staff person with them. That's what I would say. I would say these are very, very wealthy hospitals, and they can afford to do this, and they should do it. It's the right thing for patients.
And I also want to chime in on that. That was the same argument that hospitals had when HPAE was working fervently to get a ban on mandatory overtime passed. That was their same excuse. We can't do it. We need the flexibility. If you take away our ability to mandate people to stay, how are we going to staff the hospitals? Lo and behold, the law went into effect and they figured it out. They will figure it out. And New Jersey doesn't have a shortage of nurses. There's a shortage of nurses willing to be at the bedside working under these untenable situations.
And also, can I just say this? California did it. Where do you think the research comes from showing the tremendous benefits to patients, to nurses, and to the hospitals? It comes from California. 20 years of research shows that there are benefits to this, and they did it. And not one hospital went out of business.
And there are other states since California who have enacted laws. So this is the wave of the future. New Jersey should be on the beginning edge of history, not the far side, one of the trailing ones.
Yeah.
Absolutely.
So just to follow up, the strike at Robert Wood Johnson lasted 4 months. That's, a fairly long strike. Did that bring hesitation to any of you and your members?
I
No,
think what
as
it brought,
frontline
I think what it brought to the table was resolve with our healthcare workers. I think there's a resolve. And I don't think our members will tolerate any less than what they saw the steelworkers go on strike for 5 months to obtain. I correct me if I'm wrong, Tara, Alice. I think it created a resolve that this is what we need.
Yes, it just shows you the
That's
times,
true.
like where the pandemic only exacerbated what was already there. And as we know, a lot of industries after the pandemic, people, made decisions about where they're going to be. And, as healthcare workers, nurses, we really truly want to be there for our patients in the communities that we serve, but we can't continue to work under these conditions. So we're trying to send the message to the powers that be that we want to do the right thing. We want to be here for our patients. We want to be here for the community. You have to respond appropriately. And we're willing to fight for that. We're always advocates for our patients. So we're continuing to be advocates for our patients, but we're also advocating for ourselves.
Thank you.
Anybody have anything else?
If no one else has another question, I just want to ask you so this bill has been around for years and it hasn't gotten any momentum. You guys and your colleagues were out in front of the State House a year ago, demonstrating about this. I remember Alice was speaking at it. What's going on in Trenton? What's happening with this bill? Why isn't it going anywhere? What are your thoughts on that?
We are gaining sponsors. I mean, if you look at the list of sponsors, it is growing rapidly. And the bill has changed earlier this year. So it became a brand new bill. We are gaining momentum, Scott. That's what I would say. We are gaining momentum. We are getting there. We are doing the work to get this bill passed.
I'm good, thanks.
Okay. Thank you, everybody. Appreciate
Thank
you
you.
coming.
Thank you.